Hello. Um, I finally gave in and I watched Queen Charlotte, the Bridgerton spin off. Now, I know you're probably wondering what Bridgerton and stuff like that have got to do with mental health, but it is relevant, I promise. And if you haven't seen it and you do want to watch it, I suggest you switch off now because there are going to be massive spoilers. Um, so, if in case anyone doesn't know the story of Queen Charlotte, the Bridgerton thing, it's loosely based on history, the UK history, and specifically King George III. Now, King George III was um, labelled the Mad King. He did all sorts of weird and wonderful things in history, and it's about him and his and Charlotte's relationship. That's kind of one of the storylines in the Queen Charlotte series. So although it's not historically accurate, it's based on those things. And what I found that was really clear to me to start off with, that they tried to keep this a secret from everybody, that George had these mental issues, and from what I could see from the beginning of his the introduction of his character into the program, the biggest thing that he suffered with was chronic anxiety, to the point where when he got into a stressful and unfamiliar territory, he would retreat into his mind um, as like a mechanism to keep him safe, so that he wouldn't be able to be touched. So he kept himself locked away in his mind, um, just for safety measures. And obviously, that's kind of gotten out of control, which is why he really struggles. Um, and it was such a sad thing to watch this poor man, and obviously being king in those days would be even more difficult, because Parliament were after his crown. He was having to marry somebody he didn't know. There was pressure on him to have an heir. So there's a lot of pressure on him. So it's no wonder that he was so anxious and struggled so much. So he took pleasure in being a farmer. That's what he enjoyed doing. He'd go out and he'd tend his gardens. And that brought him peace and joy and safety. And he was also very into astronomy. So when he retreated into his mind, he was, with planets and the stars and all that kind of stuff. Um, but what was really beautiful was how Charlotte seemed to capture him. And what I mean by that is, even though even though he was really struggling, she had this way of reaching him. Even when he was in the dark recesses of his mind, she was still able to capture him. Now, don't get me wrong, in the programme, she's an absolutely shite mum. She really is. I mean, I'm not being funny. Who goes up to their child when they've just lost their own child and all she can say is, sorrows, sorrows, prayers? She couldn't even hug them. I found that very sad. But the way she took care of George was admirable. It was brilliant and beautiful. So she would meet him where he was. So rather than treating him like a king and, trying to tell him to, just get on with it like everybody else was doing, she would talk to him as just George. And she became his safe space. And he managed to overcome quite a lot because she was by his side and he knew that she was there for him. So she become that real safe space for him. So he didn't need to always be gardening or in his astronomy tower looking at the stars. He had someone that was with him and that could get to him, and he loved her so completely, and she loved him as well. It was very clear. There was one scene when he was like in the younger part of the program, when he was a youngster, where he had to go to Parliament because Parliament were going to take his crown, because no one had seen him for ages, because it was rumoured that he was mad, and he was having a doctor like take care of him, sort of thing. And he got in a carriage and he's riding along to Parliament. And in those days, women weren't allowed to go into Parliament. We weren't allowed in. It was just, completely forbidden. So Charlotte couldn't go with him, but he had his script, so he knew what he needed to say. And he's in the coach and he's trying to memorize, and he can feel himself, the anxiety attack starting. And he ends up curled up in a fetal position in the bottom of the coach, and he won't let anybody in, and he has to go home. Which was really difficult because Parliament then see him as weak, which is not a good place to be as the monarch. And when Charlotte goes in to see him, he's under the bed because he's hiding away. So she gets under the bed with him in all her gowns and her finery. She gets down on the bed and she goes under the bed and she just talks to him, and she's able to reach him from where he is and bring him back and tell him that he's amazing and that everything that they do, they're going to do together. And she reinforces that he is safe with her, that she will look after him, that it's absolutely fine. And that is just it's just the most beautiful thing. And it's echoed towards the end of the series when she finds out one of the children, hers and George's children, are pregnant, and they're both getting on in years now. And she goes into George's room, and he's drawing on the wall. He's drawing like astrological symbols, um, planets and how they rotate around the sun and that kind of stuff. And she's trying to talk to him to tell him something, to tell him this important news, and he can't hear her. He can't get it. He's just no, he's just lost. He's absolutely lost. And so what she does is she goes back under the bed and she calls him. She calls for just George. And when he comes under the bed, she's able to then reach him as just George. And he comes back and she's able to tell him the good news. And, I found that such a touching, beautiful thing that she, even as a queen, even with all of those gowns on and everything, because she loved him so much, she would do whatever it took to get through to him, to bring him back. And that was lovely. I mean, there was another scene where he was being looked after by a doctor who was from Bedlam. So that was the Bethlehem Hospital where they used to put mental patients in Georgian times. And that was an actual real place. And apparently Georgians would go and pay to go and watch the mad people. Can you believe that? Could you honestly believe that in this day and age? I'm so glad things have moved on from that, I can tell you. But he comes to treat George, and he thinks that for George to get better, he has to break his spirit. And basically, he tortures him. That's all it is. They stick him in an ice bath. They try and drown him in an ice bath. They burn him with hot pokers. They bleed him using leeches. There's so many horrific things he goes through. He's fed gruel, and that's all he can have. He can't have like a proper meal like everybody else. He has to be obedient. And as a king, that's really it really brings him down. And he believes that this doctor's going to help him, but basically this doctor is just torturing him, really. I mean, look, I think the doctor honestly believed that that was what would save him, but from the way things are now, you can see it's just awful what he went through. And Charlotte rescues him. She finds out where he is. She goes there and she dismisses the doctor and she rescues George, and then she takes care of George. But that's what I wanted to really kind of reiterate, really. As a carer, we are our person's safe space. We're here 24/7, 7 days a week, 365 days a year. Maybe we get a little bit of time off for some respite if we are lucky, but not everybody is that lucky. I am lucky. I do get to, like tonight I'm going dancing, which is why I'm dressed like this. And I get to go on a weekender now and then. But in general, many of us don't get a break. And we are that safe space. We are the ones that our person relies on, even if they are unhappy, in pain. whatever it is that they're going through, it's us that they look to. It's us that help them to just be who they are, to make sure they get to their appointments, to make sure they take their medication, to make sure that they're comfortable, to make sure that they're safe. And whether that's physically safe or mentally safe or emotionally safe, that's what we have to do. And I just thought it illustrated the beauty and the magnificence in that. So if you haven't seen it, and if it is your cup of tea, give it a watch, because honestly it was absolutely beautiful. That part of it, that part of the story was absolutely beautiful, amazing. So well done to the people who wrote Bridgerton, because that was really good. It was such a beautiful thing to watch, how they came together and worked together as a team, because that's what we are with our person. We're a team, to keep each other safe. And I just thought that was really good. So, yeah, that's what I wanted to really talk about today. I hope you're all okay and you're doing well, and your person is doing, or your people, if you're caring for more than one. Hope everyone's doing okay. Um, don't forget, you can buy the journal. I'll put a link to that in the description, in the comments and whatnot. So, yeah, hopefully everything's going well for you. And at the moment, everybody's in a good place. And if you're not, well, I'm thinking of you. And you can always reach out to me. And I might not be able to do anything to physically help you, but I can listen. So if you need me, you know where I am. All right. I'll see you all later. Bye.